Now, in the movies, it's quite different. There's a group of handsome epidemiologists ready to go. They move in, they save the day, but that's just pure Hollywood.
I think what he's saying is we need some more handsome epidemiologists. I think that's a bit of a diss. Come on, Bill. Portrait painting yourself. Hello and welcome back to the channel. Now, I'm going to keep up the content on COVID-19 just because it's still forming a big part of what I'm doing day to day in the emergency department. So I know many of you who subscribe to the channel don't just come for kind of an update on that. They like my sort of more traditional, light-hearted look at medicine. So I'm going to try and factor that in a bit and bring in some of my usual content onto the channel. Today, I'm going to do a bit of a crossover. I said it's a little bit light-hearted, but I'm going to be checking out the video that Bill Gates did in 2015 and April time, so almost exactly 5 years ago. That just shows the kind of type of world we're in at the minute, where this is my light-hearted content, where I'm reacting to a video on a pandemic. I did a video myth-busting some of the conspiracies around COVID-19, but I've also read some thinking that Bill Gates is behind some master plan to release the virus. And I think this video has been used as kind of proof of that, because he kind of predicted it. Clearly these are just conspiracy theories, because Bill Gates is an intelligent person, a well-connected person, so he's gonna know what kind of global risks are out there and gonna want to highlight them. So the video is called The Next Outbreak, We're Not Ready. So I wanted to see how much foreshadowing this had on the actual pandemic and how much he said has actually come true, and you know, were there lessons that he was pointing out that we've seen needed to be learned before actually this happening? So let's check it out.
When I was a kid...
So he just wheeled in a canister of biomaterial there. I think he's off to a bad start.
The disaster we worried about most was a nuclear war. That's why we had a barrel like this down in our basement, filled with cans of food and water. When the nuclear attack came, we were supposed to go downstairs, hunker down, and eat out of that barrel.
That's funny that that got a kind of laughing response there. We know now that this kind of nuclear war didn't happen, so it's kind of funny and people seem a bit silly that they were stocking up on food like this. But I wonder how many things, and I don't mean the general public, because that's what he's talking about here, but I mean governments and things were kind of scoffing at the idea of stocking up on things like PPE given a pandemic. And you know, a lot of people think, why are you wasting money on that type of thing? And then suddenly we're in it and we need that stuff, and suddenly those people, you know, aren't the ones to be ridiculed.
Today, the greatest risk of global catastrophe doesn't look like this. Instead, it looks like this.
I mean, what can you say? I mean, that is literally black and white what he said now. What we're living in the pandemic at the moment. Obviously, he's shown the influenza virus here rather than a coronavirus, but we're talking about the same thing here.
Not missiles, but microbes. Now, part of the reason for this is that we have invested a huge amount in nuclear deterrence, but we've actually invested very little in a system to stop an epidemic.
This is an interesting point, actually. I highlighted in one of my first vlogs that a lot of money had gone into things like defence, and at best you can kind of agree with what Bill Gates said here in terms of it being a deterrent, and therefore just by having it meant that we're more likely to get peace because everyone has a deterrent. Is that the way it works? But that's what he's claiming here. But kind of at worst you could claim that many of these military companies are kind of in with the government and so lobby the government to get funding and things like that. Either way, you have to acknowledge that the amount of money being spent on the military is disproportionate to the amount readying us for the type of thing that we're going through at the moment.
Let's look at Ebola. The problem wasn't that there was a system that didn't work well enough. The problem was that we didn't have a system at all. In fact, there are some pretty obvious key missing pieces. We didn't have a group of epidemiologists ready to go who would have gone, seen what the disease was, see how far it had spread. The case reports came in on paper. It was very delayed before they were put online, and they were extremely inaccurate. We didn't have a medical team ready to go. We didn't have a way of preparing people.
Interesting to talk about that. I don't know a lot about what happened in Africa with the Ebola outbreak, but taking that principle to what I've seen in the UK here, many of those things can sort of be agreed with. We have a healthcare system here, and although I'm sure there's many specialist people that did feel well trained to be dealing with that, I think it was pretty much declared a pandemic already before I had any real specialist training on what we were dealing with in the UK. A lot of the learning I had to do was kind of off my own bat, which, you're used to doing as a doctor. I feel like we're going to learn a lot more in how we respond to those things. Not only that, but information that was coming to us as doctors from the top up would very often change day to day, often hour to hour. I remember it distinctly where I was in the red zone in the emergency department and we weren't allowed to wear masks when we were just in the red zone. It was only when we went in to see patients. And then one minute we were doing that, the next minute we were all wearing, having to wear masks in that area. And now the government just this week means we have to wear masks everywhere, not just in the red zone. And it makes you think, well, hang on a minute, at what point have we been doing it wrong? At what point have we been putting ourselves at risk? And that's in the UK. We have a pretty good healthcare system. I mean, you could say what you like. I know a lot of people on the channel are very protective of the health system in their own country, but we're very proud of the NHS in the UK. So if we're having issues in well-established healthcare systems, imagine what it's going to be like in places that don't have the resources, don't have the technology.
There was no one there to look at treatment approaches, no one to look at the diagnostics, no one to figure out what tools should be used. As an example, we could have taken the blood of survivors, processed it, and put that plasma back in people to protect them. But that was never tried.
Very relevant point to this pandemic as well. So if people have the illness and they get better from it, they'll build up antibodies, and those antibodies stay in the blood. We can extract that blood, but then extract the antibodies by taking the plasma out, so the kind of fluid portion of the blood, and then we can give it to people that have currently got the illness. It works for things like rabies. I'm not sure if we have evidence yet if it works for COVID-19. Because we know these type of things work, should we be gearing up some of our resources and some of our research into getting those type of systems ready for future pandemic? Difficulty is that we're always going to have a lag between when something hits and then being able to try something out, because we very much believe in testing our principles and using evidence before we kind of roll it out to large numbers of people. So there is always going to be a lag, and these things take a lot of time because we're dealing with people's health and people's lives, and we don't want to get things wrong.
The WHO is funded to monitor epidemics, but not to do these things I talked about. Now in the movies, it's quite different. There's a group of handsome epidemiologists ready to go. They move in, they save the day, but that's just pure Hollywood.
I think what he's saying is we need some more handsome epidemiologists. So any epidemiologist looking out there, I think that's a bit of a diss to your looks. Come on, Bill. Portrait painting yourself.
There's 3 reasons why it didn't spread more. The first is there was a lot of heroic work by the health workers. They found the people and they prevented more infections. The second is the nature of the virus. Ebola does not spread through the air. And by the time you're contagious, most people are so sick that they're bedridden.
So that is an interesting thing he talked about Ebola there. So it doesn't spread through the air, and by the time you're infectious, so spreading it, you're likely to be so sick and bedridden. Both of those things have not been true in coronavirus. We know it spreads through droplets in the air, so the moisture in our breathing, so it can spread by very close contact, and particularly coughing or sneezing. And we know that you can be contagious before you show symptoms. So in Ebola's case, both of those things weren't true, so that kind of limited its spread. And conversely, both those things were true with SARS-CoV-2, the virus that causes COVID-19, and so led to its rapid spread.
Third, it didn't get into many urban areas, and that was just luck. If it had gotten into a lot more urban areas, the case numbers would have been much larger.
It's interesting, said the third thing here, it didn't get into urban areas, so densely populated areas. which we know has been true with COVID-19. And the biggest areas that have suffered are places that are very well developed. Look at London in the UK, Birmingham in the UK, and wider across the world, places like New York. You're pretty much picking the most densely populated places in those countries.
You can have a virus where people feel well enough while they're infectious that they get on a plane or they go to a market. The source of the virus could be a natural epidemic like Ebola, or it could be bioterrorism.
I mean, again, he's basically just telling it exactly like it is. The globalization and the physical network that we have with planes and transport across the world now has been part of the problem. I don't think that should necessarily be stopped. We should all go back to just living in the same village we grew up in.
In fact, let's look at a model of a virus spread through the air like the Spanish flu back in 1918. So here's what would happen.
I've heard lots of comparisons with the Spanish flu, actually, and that's amazing that managed to spread so fast. 1918, without commercial flights, it would have nowhere near the connectivity that we had, but there was still enough for this to spread around the whole world. Almost, I think, 50 million people died from it. Extremely tragic.
In fact, we can build a really good response system. We have the benefits of all the science and technology that we talk about here. We've got cell phones to get information from.
That is a huge thing now. We need to embrace it. Imagine if this pandemic had happened 30 years ago, how different things would be. And I'm not just talking about the medical response to it. I'm talking about just coping with lockdown. How much of our interactions have now had to happen online. Even things with, seeing our GP, going to work, socializing with people, making sure your family members are okay. Even though this has happened, we have to be thankful of kind of when it's happened.
We have advances in biology that should dramatically change the turnaround time to look at a pathogen and be able to make drugs and vaccines that fit for that pathogen.
Well, that is true. So I was kind of blown away by how quickly we could develop these kind of testing to figure out what a pathogen was. Now, before this pandemic, I didn't know how quickly we could develop a swab test, so using a PCR to find out the specific virus that's causing your symptoms. And so that kind of research was done, originally in China, but then that information distributed around the world. Then suddenly existing test centers could use that information to process these swabs to make sure if you've got the virus in your throat secretions when you have the swab. Over the last few weeks, we've seen antibody tests, so blood tests that we can actually look for antibodies in the blood as well. These are all positives to be coming out of this.
So we can have tools, but those tools need to be put into an overall global health system. And we need preparedness.
In the UK, we just launched our track and trace last week. So you register if you've got symptoms or a positive test, and that can notify people around you. It's had many success in places like South Korea. There's been a lot of controversy around the one launched in the UK, that it's not quite ready yet, and it won't be fully operational till later in the year. All these things are going to have teething problems. I think this is what Bill Gates is saying, is that why didn't we have something like this in place when he talked about this in 2015? If we've managed to put something together so quickly and, we've got these teething problems, surely we should have been working on it over the last few years, and we probably would have been able to do it cheaper, more efficient. And it comes back to that idea of storing food in the can, waiting for the nuclear war, is that people kind of laugh at the fact that you're investing in these things.
The best lessons, I think, on how to get prepared are, again, what we do for war. For soldiers, we have full-time waiting to go. We have reserves that can scale us up to large numbers. NATO has a mobile unit that can deploy very rapidly. NATO does a lot of war games to check, are people well-trained?
It's interesting what he's saying there, using the war comparison. That does fit in many ways. We kind of have the resources, like in individual level, but not the organization to bring them all together. We have the World Health Organization, which is there to monitor and advise, but they don't necessarily have the boots on the ground response. They rely on the governments to then put that together. And then it filters down to people like me who then have to deliver stuff on the ground. But I don't really feel part of this wider system to be able to deliver that. I just feel like I have a job that I go in and do. There's no kind of NATO that sits over that has the ability to bring resources in together and distribute them to the places that most need it. And that's not just as a charitable thing to help out those places, not just like a humanitarian thing to help out those places, it's to stop it spreading around the whole world.
What are the key pieces? First is we need strong health systems in poor countries. That's where mothers can give birth safely, kids can get all their vaccines, but also where we'll see the outbreak very early on.
He makes a really good point. I know there's been coming up to something like 500,000 deaths from COVID-19 across the world. We can't forget that places like Africa, where infectious disease is still the #1 cause of death, like millions of people every year die of diseases that are preventable, and often preventable with just, a few pounds, a few dollars worth of treatment. As I said, we should be doing that out of humanitarian reasons to strengthen the healthcare systems. But now we have a purely selfish reason, the fact that outbreaks can, due to global connectivity and the poor healthcare tracking and treatment in those places, means that they can directly affect us.
We need a medical reserve corps. Lots of people who've got the training and background who are ready to go with the expertise.
The Medical Reserve Corps, he's so right. Why doesn't something like that exist? I know we had the Nightingale Hospital in the UK that, asked lots of volunteers to come and commit to shifts. But if you think about it, that hospital, where are they getting the staff from? They're probably getting it from other hospitals. So we need to have a recognition of a system in place that people are permanently signed up to, so that they're ready to go and they can have the training all the year round, not just when something hits, suddenly have to get the training then.
We need to do simulations. Germ games, not war games.
Germ games, not war games. I think the UK a few years ago did do a simulation of this kind of war game, and there was I think Freedom of Information Act to publish what came out of that, because I heard don't quote me on this, I'm going to probably have some legal proceedings against me, but I heard there were lots of recommendations that came out of it, and I think the worry for a lot of people was, well, did we do anything about that? Particularly things like shortage of ventilators. I think that might have been something that was highlighted. Has someone been negligent within that because they haven't responded to the recommendations?
Now, I don't have an exact budget for what this would cost, but I'm quite sure it's very modest compared to the potential harm. The World Bank estimates that if we have a worldwide flu epidemic, global wealth will go down by over $3 trillion. And we'd have millions and millions of deaths.
This is where I find it very difficult. These numbers are so big to me that I just cannot calculate them in my head. I'm sure many of you will agree, but look at the amount of disruption we've had in this pandemic. People unable to work, the government having to subsidise. I mean, when we talk about the government subsidising, let's not beat around the bush here. We're going to be paying the economic costs for this for a very long time. Bill Gates is right, and this is very much the kind of old adage of prevention is better than the cure. We're using our own metaphors from medicine to describe how we should have responded, how we should have prepared for this pandemic.
In fact, if there's one positive thing that can come out of the Ebola epidemic, it's that it can serve as an early warning, a wake-up call to get ready. If we start now, we can be ready for the next epidemic. Thank you.
Very good talk. Yeah, of course it's going to be from a guy with those kind of credentials. That last thing he says there is obviously a very positive message. Knowing what has happened now, hearing that last bit does have this kind of foreboding type spin on it. It's very difficult to watch, actually. All the things he said there, I can identify gaps in what's happened now. And we had, when this was done, 5 years to respond. Now, I'm sure that things have been done behind the scenes that, I'm not privy to, but we all know things could have been a lot better. And when you have people in Bill Gates' position, intelligent people thinking about these things, you must ask the question, well, why haven't governments and larger organisations been heeding this advice? So I hope you've enjoyed this kind of slightly different video and more kind of back to my usual stuff. Thank you so much for all your continued support on the channel. I've got a few night shifts this week, so I may do a little vlog there depending on how I'm feeling. But I hope you're all well and take care of yourselves, and I'll see you soon.